So I have a secret hat I use sometimes. It says, make your smile great again. So I wear that when I work on my patients. So when they look horrified or complain, I quietly cut back on the laughing gas and say, you got this. It's not as bad as you think it is. I stole that from Joe Biden.
Jokes too. We make jokes as well. Like, why can't we just take a joke lightheartedly? But that was taken to cancel me. And the dental board did an investigation. They cleared it out and said there was nothing they could find that proved any of that. So, and now after a few months again, this has erupted. So I'm obviously linking it back to the same person that started it to begin with. And this video is from 2 years ago. I'm the one that posted the video myself, because we post lots of little short snips of like me. I'm a stand-up comedian for pretty much most of my patients too. We joke around. You gotta live life and you gotta laugh. Life is too short. So you enjoy it as well as you can too. So I don't think I did anything wrong by making a joke. Jimmy Kimmel can joke, but I can't joke? That's not fair.
Meet Dr. Harleen Gruel. She's a board-certified dentist and the owner of Skyline Smiles in Santa Clarita, California. Not only did this doctor publicly brag about causing harm for patients, she also bragged about how she preferred that certain patients didn't come into her office altogether.
Imagine walking into a dentist's office only to realize your political beliefs determine your pain. Now, what if your care depends not on your dental issue, but on your vote? Now, today we are diving into a jaw-dropping confession from a self-proclaimed MAGA dentist who admitted she withholds relief and allows Democrats to suffer more during treatment. Now, that's right. She's saying she treats you differently because of politics. Stay with me. What she said, how it's being defended, and whether this crosses into illegal territory will definitely shock you.
That MAGA pediatric dentist that got online and admitted to lowering the anesthesia on her pediatric patients based on their political beliefs should lose her license to practice dentistry in the state of California. She says that she has her office decorated with Make America Great Again posters of Republican officials, even one of her and Trump together. And then she has her dentist helmet that says, Make Your Smile Great Again. And based off of the pediatric patient's reaction, that alone will determine whether or not they get the full anesthesia during oral procedures. She says that she leans over to the patient, lowers the laughing gas, and then tells the child, see, it's not that bad. Yeah, that's medical malpractice. You are intentionally exposing children to unnecessary pain during oral procedures, and that is child abuse. Okay? And what's really sad is that apparently you got 11 medical malpractice lawsuits pending against you. Okay? Politics don't belong in a pediatric dental office. If they don't belong in school, they definitely don't belong in a medical setting, at a hospital, at a pediatric dental office, whatever.
Right? Well, you know that dentist I was talking about the other day that is MAGA has admittedly said that she plays with the, numbing gas if her customers show some kind of dislike for MAGA Republicans, right? Well, one of my people came into my comments and said, her husband is a neurologist. Huh? That's even scarier. So I did a little bit more digging. Come to find out, he is a neurologist in Valencia. His practice is Valencia. He is a partner in the mind-body infusion company with his wife. And there's a write-up about this couple. Beautiful. In the write-up, Harleen is talking about how their business and personal go hand in hand and how they share the same views, they have the same goals, and he specializes in strokes. And the flags immediately went off like, that's hypertension, high blood pressure, that's something that impacts our community so much. I wonder if he shares the same views. Listen, I'm not here to ruin nobody's life or to make it hard for anybody, but when I hear about people purposely inflicting pain, that's a kind of racism when you have that kind of power over people and they come to you in their time of need, desperate time of need, and you do something like that. Maybe there should be some investigating into him too.
So do y'all remember that pediatric dentist who got on here and proudly proclaimed that she would actually take away pain medicine without consent if she noticed that her patients were uncomfortable with her being an outright Trump supporter? Yeah, so the good news is, not only is she most likely facing losing her license and her practice, but now she's probably facing multiple lawsuits from other dental practices. Why? Because obviously after that clip went viral, a lot of people wanted to try and find where she worked because she obviously shouldn't be working with patients, especially children, because she's a psychopath. However, there are multiple practices across the country, I think even some in her own state, by the same name. And we have now had several owners from those other practices come on here and say they have lost business, they have had appointments canceled, they have had their reputations damaged because they were confused with this other person. And if they can prove that there is like tangible loss, they can sue her and her practice for loss and damages. It just makes my little heart sore that she's going to be in court for the next years and hopefully has to pay, I don't know, tens of thousands of dollars. But most importantly, I hope she never works on another patient.
You have to remember that the person she was campaigning for in that video is Charlene Johnson, who's actually now a college board member in the city of Santa Clarita for the College of the Canyons. In case you want to see, she's right there. And here she is again, looking ever so studious, but she's actually a realtor working for SJ Partners in Santa Clarita. So if you're in Santa Clarita or the surrounding areas and thinking about buying a house, you may want to reconsider whether or not you want to do that from a woman who celebrated and took money from a person who actively tried to harm her patients. In this photo, Charlene Johnson is celebrating that she's out campaigning with her son, who I'm not going to show here, but I wonder how she would feel if her son received some of the treatment that Dr. Graywall promised to do to Democrats.
Of course, a massive violation of healthcare ethics, and I really hope she's lost her job. Intentionally causing pain to a patient because they disagree with your political beliefs is not only immoral, it should cost her her license. This really shows the danger of hyper-partisan politics affecting our everyday lives. Dentists, doctors, and nurses are supposed to be trusted with providing people care, not weaponizing their positions to punish people they disagree with politically. And the fact that she would go and brag about this publicly shows how normalized political cruelty has become in this country. I wonder if the Trump administration's constant narrative that they're the good guys, they're the godly people, and the Democrats are the evil Satanists would have anything to do with this. The problem we're facing in this country is way bigger than just one dentist hurting their patients. Since Donald Trump was elected the first time in 2016, this country has become more divided than it's ever been. It's gotten so bad that even dentists are now bragging about hurting their patients because they're Democrats.
From the very moment that video resurfaced, the internet ignited Dr. Helene Grewal, operating under the brand Make Your Smile Great Again, allegedly admitted during a Republican gala that she sometimes cuts the laughing gas for patients who lean Democrat. Now, she reportedly says that when a patient looks horrified or complains, she quietly dials back the gas, reassures them, and says, "You got this." And this video, originally recorded in 2021, has gone viral again, and it's opening up intense questions about medical ethics, professional responsibility, and even civil rights. Now, what makes this story explode is the mixing of service and ideology. A medical professional's job is to treat pain and not politicize it. Now, yet here we are talking about pain as a tool of discrimination. Critics are calling her statements not only moral, reprehensible, but potentially illegal. Some civil rights attorneys argue that discriminating on the basis of political beliefs, especially in an environment of healthcare, could violate state laws. Now, Grewal, that is Dr. Helene, has defended herself, claiming her remarks were roast jokes or part of political banter, not serious medical policy. She even says she was investigated by the California Dental Board and cleared, asserting there was no evidence of wrongdoing. Now, yet critics ask, can something be legal if it's unethical? And was the investigation truly independent or just a perfunctory review? Now, let's unpack the stakes. First, professional ethics. Dental associations expect impartial treatment. You don't pick who deserves pain relief based on ideology or identity. Second, public trust. If patients believe care is contingent on politics, vulnerable groups may avoid seeking treatment, fearing bias or even harm. Third, legal ramifications. If any state or federal statute based discrimination based on political affiliation or bans refusing service for ideological reasons, she could face formal charges or licensing consequences. We must also examine the power dynamics. Patients are in a vulnerable position. They rely on professionals for health and relief. If a professional suggests subtly, I'll ease your pain more if you belong to my camp, that creates a coercive environment. One can't consent really under such conditions. Now, critics counter. She only joked it. She claims she never actually withheld gas during a procedure. But that defense rings hollow when you've publicly boasted about doing it. Words matter. When a professional operator openly confesses to differential treatment, the burden shifts to her to prove she didn't act on it. And also, the fact that she has branded her practice with Republican symbolism, displaying photos of GOP officials swearing "Make your smile great again" hurts while treating patients, intensifies the impression that politics is central to her business. Some patients allegedly walked out when they saw the decor, reports say refusing service altogether. At the end of the day, this isn't just about dentistry. It's a flashpoint in a polarized America. The moment when partisan loyalty seeps into medicine, into trust, into whether a person is worthy of basic care, whether or not she's punished, the damage is done. Patients will look at every white coat and wonder, will I be treated well just for being on the wrong side? So what must happen next? Demand transparency. Regulatory bodies must audit her records, check anesthesia logs, patient complaints, gas usage, billing. Journalists should push for those internal documents. Politicians and health boards should weigh whether ideological bias should be a disqualifier in medical professions. And patients must also remember their rights. If you feel you were mistreated because of your beliefs, file a complaint with the dental board and involve civil rights groups. Because if we let a precedent stand, it's okay to inflict extra pain for political reasons, then we are crossing a line from healthcare into coercion.